I can't guarantee that you're not going to have some swelling or bruising. Hi, this is Dr. Kim. Are there ways where you can reduce the risk of bruising or swelling after an injectable? Well, yes. After botulinum toxin, neurotoxin, HA fillers, or more, there are some ways to help reduce bruising. Essentially, you have to understand, as a general introduction, if you're poking tiny little holes in your face, then yes, there's always a risk of bruising. This is true if you have a vaccine. This is true if you have a tiny insulin needle, where if you're diabetic, you may need insulin through a needle, and so on. I can't guarantee that you're not going to have some swelling or bruising. However, before you actually have any procedure, some hints would include being aware of your overall medical history. Don't take any blood thinners if you don't have to. So some of this is aspirin, but also some of it are medications in the aspirin family. These include ibuprofen, Motrin, Aleve, naproxen, naproxen, a couple others, or maybe a lot of others, but anything in that classification of pharmaceutical will increase bleeding. Another thing, of course, is actually not to drink alcohol right before and right after your injection. Of course, people probably are not taking alcohol right before they see me in the office, but afterwards, if it's the end of the day, I would definitely avoid alcohol if possible. If possible, you should be able to take bromelain, which is a supplement. It's also in pineapples. If you eat a bunch of pineapples before your procedure, and technically you should have them maybe a day or two to help build up the bromelain, then yes, you should be able to help reduce the risk of bruising and swelling after your procedure. I don't think this is that controversial, but it is slightly controversial in the sense that we're not exactly certain of the exact perfect amount of bromelain to take right before your injectable procedure. But yes, it does help. Certain types of supplements really don't help with bleeding at all. In fact, they may cause more bleeding. Sometimes fish oil is in that category. A lot of unknown supplements where it's not like you get it in a pill form or from a large company. Rather, if you're going to your local herbal store or getting stuff from your herbalist, that I found anecdotally, in other words, not consistently, but once in a while, those supplements seem to actually increase bleeding. Be careful of what you're actually taking to your body. Finally, of course, you have a history of blood thinners where some patients have a heart condition, they need to take a blood thinner. By default, yes, you can still typically get injectables, but you may be more prone to bleeding, bruising, swelling after your procedure. Right after your injectable session, while you're still in my office, I'm going to actually make sure to ask you to put some pressure on the area. You may have little bumps. I think that does help to prevent bleeding. Ice packs help. They cause vasoconstriction, which makes the blood vessels smaller or tighter. That also, I think, helps to reduce swelling and bruising and bleeding. Finally, elevating your head helps to reduce any excess pressure. Now, of course, we're not going to have you hang out in my office for a couple of days afterwards to elevate your head. But typically, a lot of neurotoxins and fillers are given in the facial area. Elevating your head helps to reduce the swelling of your face. And really elevating it means placing your head above heart level to help reduce any potential swelling that may try to occur. Things that may help, I'm not certain about this, would include arnica or echinacea. Those are herbal or homeopathic medications. And to be honest, some of the studies are very, how do you say it, like contradictory. Like some studies seem to show that it helps, other studies show that it has no effect at all. I don't think we've done, honestly, a really great study where we've done a placebo-controlled, double-blinded, blah, 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 nerdy biostatistics talk onto which actual group of patients would do better and observe them over a longer period of time. In other words, consistency and looking at them over a couple weeks. But hey, if you know about that study, let me know. I did do some research before this video. The thing that definitely seems to help is a product known as Alastin's Enhance. Yes, I sell it in my office. No, I am not an investor in the company, but applied right after the injection, yes, my patients need to have a little less bruising immediately. Finally, afterwards, some of this is common sense, but you should hear about it. You don't want to exercise or exercise vigorously right after your procedure. If you really want to, you can, but any increased blood flow, especially if you already have some swelling or potential bruising happening, then yes, you want to avoid that. Finally, don't take blood thinners after the procedure. And again, I'm thinking of ibuprofen, aspirin. Taking it right afterwards probably doesn't help things at all. I hope this helps in terms of you being able to avoid potential bruising and swelling. Now, if you notice, I said possible, because again, if I am injecting very carefully under controlled conditions, using every trick I know possible to help reduce swelling and bruising, you may still have it. Now, of course, I don't know how grumpy you should be or not, but yes, we're trying to mitigate to reduce that risk if possible, and there are definitely some things that you can do to help reduce that risk. If you know of any other hints, please let me know. And if you have any questions, fire away below. Thanks so much for watching.